be safe and good. You brought an excellent question before about that low testosterone could be worse than testosterone replacement. Yes. So I will reference to everybody watching this video a specific article to look at. I remember that article very well because it came at a very necessary time. It's in the Mayo Clinic Journal of Medicine, and that was published in February of 2015. And it's a meta-analysis about all the testosterone study results on cardiovascular health. Because there was a very mal-designed or poorly designed study that was done by the VA hospitals. So they decided to take patients and put like this group of men in testosterone replacement and this group here no testosterone replacement and compare what's the outcome. Unfortunately, it's a fact and it's well known in the United States of America that patients in the VA hospitals are not necessarily receiving the best care. So this is not something I'm shy to talk about. So a lot of these patients, were not very well treated. Their medical conditions are not well treated properly, whether it's diabetes, high blood pressure, cholesterol, obesity, smoking, etc. So when you take a group of people that are not in the most perfect health and you decide to suddenly give them testosterone replacement, these guys started to get more active suddenly, more exercise, more sexual function. All of a sudden, they start to have some heart attacks. Well, that's very expected if they're continuing to smoke or.
Right.
So we all of a sudden, testosterone is killing people with heart attacks. Everybody needs to get off testosterone, stop testosterone. When this study came out, Mayo Clinic, within a short period of time, followed with that meta-analysis that looked at all the testosterone studies over a long period of time in the United States, and they came to the conclusion that actually testosterone replacement therapy is beneficial, especially in men that have metabolic conditions. And you will see every word I'm saying reference exactly in the article. So if somebody has hyperlipidemia, has diabetes, has like a metabolic disease, actually fixing their testosterone was very helpful. In my experience, which in the medical field, we call it anecdotal reports. Anecdotal reports meaning is not a rigorously studied, randomized patients, which we cannot do all this in medicine. Many years of treating patients, I noticed that diabetic patients, once you properly fix their testosterone and reduce their obesity, central obesity and their belly size, this patient is much easier to control their diabetes and they do much better and their health is much better. And the summary of the Mayo Clinic article I'm referencing, that actually there was cardiovascular benefits, not cardiovascular harms. As of today, 80% of cardiologists in the United States are against testosterone replacement therapy. You ask any of them, I tell my patients who come to me and tell me, I've seen a heart doctor, he said this. I give them a copy of the article and then I say, go challenge that guy and ask him, are you aware of this? When he tell you no, then give the paper and tell him, here it is, get something to learn.
Wow.
Yeah.
That's fascinating. I never would have imagined that the testosterone would be linked to glucose levels or diabetes issues.
Because the patients that we replace their testosterone properly and they start to exercise, the testosterone has benefit with the exercise and the proper diet and reducing central obesity. So central obesity triggers what's called insulin resistance, which progresses into diabetes. So so testosterone helps to reverse that process.
So you're building muscle. You're going to be more active.
Correct.
And then you're going to, like you said, reverse
reduce body fat, especially central obesity.